I have the great pleasure to introduce two of my colleagues, Daina Fail and Dr. Samantha Loi. Daina's the social worker here at neuropsychiatry, Royal Melbourne Hospital, and she works across the inpatients and the outpatient teams. She's got a strong interest in family work and is currently completing her Masters in Family Therapy and Systems Therapy. Dr. Sam Loi is a neuropsychiatrist and Senior Research Fellow at the Royal Melbourne Hospital and the University of Melbourne, as well as working with older and younger people with dementia. She is a strong advocate for carers and has completed her PhD investigating factors associated with depression in older carers. She's currently researching the psychosocial outcomes of people with younger onset dementia and their carers as they traverse their pathways to diagnosis and ongoing management. Thank you.
Hey everybody, my name's Daina. I'm the social worker, as Camille said. I'm going to talk a little bit about carers, as opposed to, we've been speaking a lot about people with frontotemporal dementia, and I really want to try and reach out to people in the audience that are actually doing the caring role, but also wanting to acknowledge that you guys are, of course, the experts rather than us, but that as healthcare professionals, we're sort of try to understand what you are trying to manage at home, particularly in these current circumstances of this year and the COVID-19 pandemic. I just want to talk about some of the positives, and I understand that these are the things that people will often tell you, oh, it must be very important to you, it must be very rewarding, and I'm sure that there is. So we'll just talk a little bit about these first. So it's you have an opportunity for personal growth, new skills, strengthening the relationship of the person that you care for. It's very, very challenging. You can meet new challenges and achieve new challenges, and you might get some satisfaction in knowing that you've contributed to improving the quality of someone's life. But we also know there are many challenges in this. One of them is that, of course, it's demanding and restrictive on your life and the person that you're caring for. Financial hardship of being a carer. 50% of primary carers in Australia are on a low income, and many can find it hard to cover living expenses, save money, and build up super, which makes life very, very difficult moving forward. Caring can be very emotionally taxing, physically draining, and they have the lowest wellbeing of any large group measured by the Australian Unity Wellbeing Index. So it's really important to keep in mind your own health and wellbeing in these situations. Carers often ignore their own health and are 40% more likely to suffer from a chronic health condition, such as back problems, anxiety, and depression. Many carers are chronically tired and desperately need to refresh with just a night of unbroken sleep, a day off, or a period of time with no caring responsibilities can actually be life-changing, feel like it's life-changing. And the other disadvantages of being a full-time carer is that you miss out on your own opportunities, such as work, building your own career, a lack of freedom and spontaneity, and a general enjoyment of life. There's a lot of talk from health professionals when we speak to carers about carer burnout, carer stress, carer burden. You may not even realise that it's happening to you. I guess the definition of it is that it is a state of physical, emotional and mental exhaustion, accompanied by a change in attitude from generally being positive about caring to appearing negative and unconcerned. But there's many stages in between that. I've got a little slide here about the difference between stress and burnout. It's a little bit fuzzy, so I hope you can see it. So you can see on the left, there's symptoms of carer stress versus carer burnout. It doesn't really matter per se, but I guess if you're starting to feel more the symptoms on the right, then it might be time to have to engage in some help, or just have a break, or just think about yourself for a little bit. So why do you guys feel carer stress or carer burden? Because you're often so busy caring about someone else as well as juggling your own life that it can become easy to neglect your emotional, physical and spiritual health. It's particularly relevant when the onset of illness happens earlier in life, as it can do with frontotemporal dementia. And we all know that life doesn't stop around you when you are a carer. So you may have children, trying to juggle work, trying to juggle a whole lot of other things in your life. And we all know we can't stop any of that. These demands on your body, mind and spirit can be overwhelming and can lead to fatigue and hopelessness. Some other factors that might come into play are some role confusion. So you might feel some stress about thinking at one point I may be a partner, now I'm a carer, where do I sit along that spectrum? The same with once I was a daughter, now I'm a carer. That can become overwhelming in someone's mind. It's important not to have unrealistic expectations on yourself, to provide all aspects of emotional and physical care and leaving a little bit of something for yourself. Lack of control over the progression of a disease, of caring resources, and a lack of control of how you thought your life may turn out, and the difference in those pictures can also cause a lot of stress. The other thing to keep in your mind is unreasonable demands, and these can come from the person that you're caring for, from the healthcare system, from service providers, from your own workplaces and from other family members, and this can have a huge impact on how you're feeling. We know as healthcare providers that we often ask carers to do a lot, and we realise that, but sometimes it's, we try and pull in other services to fill that gap, but we also know that we put a huge amount of burden on carers. When does carer burnout occur? When you don't get the help that you need, when you're doing more than you're physically able to, and if you start feeling guilty or indulgent if you're spending time on yourselves, lack of resources, frustration in accessing services, and that feeling as a carer that you aren't good enough or inadequate if you actually ask for help can lead you down that track to some burnout. I've just got a few symptoms of carer burnout on the screen here. Obviously a whole lot that may be individual to you and your situation. So withdrawal from friends and loved ones. You may not feel like you've got anything to contribute anymore, or that you may be talking about the same things. Loss of interest in your usual activity, changes in sleep and appetite, that feeling of feeling blue and hopeless and helpless, becoming sick more often, becoming irritable more often. Some of these symptoms are actually similar to depression and could actually manifest in you requiring some of your own clinical treatment, and I think it's important to be aware of these. I just wanted to talk a little bit about emotions and caregiving. Whether you're at the beginning of your journey or in the middle or towards the end, there's going to be a whole lot of emotions that come up for you as individuals, and I think it's important that they're validated and that some of this does become about you and not just about the person that you're caring for. And it's hard for some of these to admit some of these feelings for fear of being judged or not wanting to burden other people. I should have a little, yes, so these feelings include ambivalence, of sometimes wanting to be the carer and sometimes not wanting to be the carer, and there's good and bad days. And I think acknowledging both sets of these feelings, knowing that hopefully neither of them will last forever. Anger, losing your cool, having frayed nerves are a normal part of being around someone who requires help on an ongoing basis and who also may not be accepting of that help. Anxiety is another common feeling of being a caregiver, and that's feeling like things are becoming out of control and not knowing how to bring those things back under control. Boredom is something that we can probably all relate to at the moment, not just the caregivers. A feeling of being stuck at home, the same routine, too tired or busy to pursue your own interests. Irritability, I don't have that up there, but I'll mention it. Lashing out because you've got little or no reserve because you're just exhausted. Depression and sadness, feeling hopeless, helpless, finding it hard to start the day, crying more than what you would ever cry, loneliness, becoming isolated, losing a sense of yourself. Friends may stop calling you since you're not as available, and you may hesitate to call them because you think that they might not want to hear about your things anymore. Loss, and I think Morelle's going to talk a lot more about loss towards the end. Loss of control, loss of your own independence, loss of your best friend or your partner or your parent, and a loss of the life that you imagined that you may have had. Resentment. You may feel unappreciated or unacknowledged by those around you, and you may feel like you're the only one providing care, and this can bring a sense of resentment, tired, impatience, frustration, jealousy. You might start feeling jealous of friends and family who can go out and do things that you can no longer do, or jealous of siblings that aren't helping you care for your parent, that sort of thing. Disgust and embarrassment is something that we don't really talk about a lot, but I think it's important to acknowledge that if your person that you're caring for is eating sloppily or making embarrassing comments, further down the journey you may have to help out with some personal care. It's completely normal to feel some uncomfortable emotions about this, and it's important to acknowledge them. Fear about what's going to happen in my life. Am I going to be able to cope? Am I responsible for things that go wrong? Scaring yourself with questions of what ifs can be paralyzing, and sometimes it might be easier to start trying to shift that what if to concentrating on what's happening now. Grief, Morelle will speak a little bit about that, and guilt is a very interesting feeling, and I think sometimes it's important to reframe guilt as the goodness in you sort of trying to come out. The guilt from feeling what you haven't done enough, or wanting the situation to end, or guilty from feeling impatient, or guilty from feeling disgusted, or guilty from feeling resentment, or guilt for thinking about your own needs above the person that you're caring for. They're all quite powerful, and I think it's really important to acknowledge them all. I've got a little, sometimes as healthcare workers, we often give carers lots of advice, which can be very overwhelming, and sometimes you might walk away thinking, how am I going to do this all? So I thought that this lady sort of represented a bazillion little pieces of information that you might walk away with, but I wanted to try and talk about some strategies that might actually be more helpful. So what actually can help is identifying and acknowledging feelings. That can be a great source of relief, and whether you do this with a friend or a professional is up to you, but I think even just talking about this stuff, the effect of this can't be underestimated. Forgiving yourself for feeling these things, keeping active. We all know about the benefits of exercise. Creating a support system, and what that support system is going to be individual to you, whether that's health professionals, friends, support groups, carers groups, online groups, family. It's all going to be up to you and individual to what is going to suit your needs. Carers groups, I think Wendy and I will speak about that a bit later. Using respite when it's available to you, don't feel guilty about it. Sleeping. Acknowledging yourself, pat yourself on the back. Just know that you're doing a good job, even if no one else is going to acknowledge you. Meditate, pray, breathe, whatever floats your boat in that way, I think is very important. And have some awareness of self-care. I think I'm going to go on to Sam now. Hopefully Sam's talk is, there we go. I'll just put Sam on.
Thank you, Daina. I'm so glad you covered some of the topics which I am only going to talk a little bit about. So Thank you for having me. And as Daina said, as a carer, you guys are the expert, and we ask you to do a lot of things. And I guess I'm just going to give a bit of a narrative about the costs associated with caring. So I'll talk firstly about the financial costs and then talk about some of the emotional and psychosocial costs and some of the reasons behind this. So what does the research tell us about the financial cost of caring? The others have talked a little bit about this, but we do know that the caring for someone, looking after someone with FTD, is almost twice as much as that with Alzheimer's dementia. And it's likely to be due to the younger onset of the disease. It's often occurring at the peak of one's earning capacity for both the carer and the person living with FTD. So these costs relate to a decrease in the household income, early departure from the workforce, with only a small number of people with FTD who are still in paid employment. And how about the carers? So because it's a younger onset disease, almost 75% of people of carers are still working full time, but they may miss out on or reject promotions and increased responsibilities for their work and career progression due to their caring role and perhaps missing days of work. Now, these days at work might be missed because they're actually attending appointments with the person with FTD. They're having to take a day off because they're worried about leaving that person alone, but also days off for themselves. So maybe attending appointments, also from the stress or the tiredness, which Daina alluded to. So whilst younger carers tend to be more robust and have better physical health, many of them report a notable decrease in their physical health. They talk about back pain, neck pain, insomnia, lack of energy and headaches, as well as the anxiety and depression. And of the different FTDs, EV-FTD, the behavioural variant, is thought to have the most costs. And this possibly could be related to things such as poor decision making, so poor financial decisions, being involved in scams and gambling and other type legal issues. So how about the emotional and psychosocial costs? So I'm just going to talk a little bit about why this might be and perhaps offer some solutions. So Alzheimer's disease is much more well known than FTD, but it's very different. Public understanding of dementia is largely based on knowledge about Alzheimer's dementia and often an older onset Alzheimer's disease. And there are distinct differences in caring for someone with an older onset Alzheimer's disease and a younger onset Alzheimer's disease. And then you add FTD into the mix, and it's vastly different. You can't assume that the issues that a carer who's looking after someone with Alzheimer's disease are the same for a carer who's looking after someone with FTD. But often the resources and the services available are geared towards older adults with Alzheimer's disease, and thus may be inappropriate or irrelevant for carers of someone living with FTD. For example, support groups, education sessions might be scheduled during business hours when you might be working, so you can't really attend. Activities for the person with dementia might be bingo or bridge, again, not really appropriate for a younger person. And I won't even start at aged care facilities and why they are inappropriate for someone with FTD. So it's not surprising that as families looking after someone living with FTD, you might be quite dissatisfied with the information given about disease, the available services and the support. You might be worried that your GP or your specialist may not be an expert or have the experience in treating someone with FTD. So there are similarities though as a carer with someone who's caring for a different dementia or an older onset dementia, often female, the spouse looking after children, but there are quite a lot of differences. And some of the differences people have looked at are the different types of behaviours and what might be more difficult, and particularly for the behavioural variant FTD. So in Alzheimer's disease, the memory problems often come first. In FTD, it's less obvious. So the behaviour and the personality changes might be mistaken as depression or stress. So you might be even less inclined to think that's actually dementia. So that's one thing. But what carers have reported that it's apathy and the passive behaviour, which is really difficult. So the constant nagging and forcing someone to do what might be the most simplest of tasks, such as getting off the couch, is really difficult. So the constant pushing and pushing and pushing, and that ties in with the different roles. So I'm no longer the spouse or the partner, I'm now like the parent. The socially embarrassing behaviours is also tough. So how do you keep brushing off comments or making excuses when your loved one says things like, oh, you must be getting fat, or you're looking not very nice today? How do you keep pushing and keep on going with that? But as a clinician, as a psychiatrist, one of the problems I think which are really difficult is the isolation which carers experience. So it's not just isolation from friends and families because you have no time, but it's a combination of the lack of insight and lack of empathy and understanding from the person you're caring with FTD. So there's a loss of friendship and shared understanding and feelings. This could be due to, as Camille talked about, not being able to communicate, so the language problems, or just by the FTD itself. So carers I've talked to said they never expected to be dealing with this by themselves. They can't talk to their partner anymore. They can't talk through the decisions together. They can't share the experiences. And it's the fact that the person they're caring for doesn't seem to care or appreciate what's being done for them. And that's really tough. So the decline and the eventual loss of capacities and emotional engagement, which is one of the most sustaining and human in a mutual relationship, is devastating. And that's what I find really difficult for carers in FTD. So how do you find a way to understand, continue with and cope with the thankless and non-reciprocated tasks of caregiving? How do you face the future, knowing that the person you're looking after is going to get worse and they are going to not have an awareness of what you're doing and that you're doing it for them? So what are some of the solutions? So first of all, there's the stigma of people not understanding what FTD is. People know what Alzheimer's is, and when people hear the word dementia, they almost automatically think of Alzheimer's. There's the Alzheimer's Day, there's the Alzheimer's Walk, there's Alzheimer's this and that. And that's why groups like this are really important to raise awareness. There are also specific support groups for FTD, and they're at appropriate hours, they're in a flexible manner, so get involved if you can. As clinicians, being aware of FTD and how it might present is really important to improve assessment and reduce the diagnostic delay. And post-diagnosis, being able to easily access services such as in-home care, appropriate day centres and activities for a young, healthy person who will potentially have embarrassing or inappropriate behaviours is crucial. Now, Daina talked a lot about this, and I would really agree, but I know it's hard. So having time out for yourself is really important. You might feel guilty about not being there 24 hours a day, but you need to have a break. So not only is easier and improved access to community services is really important, but having appropriate activities and paid carers who are educated about FTD, so they know what to expect, is also crucial. Another practicality which I have experienced is having a much smoother path to financial, to improve your financial situation. So I talked a little bit about the costs, and Daina talked about this as well, but accessing super and insurance is a nightmare. So because you have a dementia, because it's young, it's less common, so they appear to be more hoops to jump through, more forms to fill, and it's overwhelming. So not only do you have to battle filling in forms, making phone calls, you're supposed to work, you're looking after a person, you've got children, it's really difficult. And these are some of the tasks having a social worker or a case manager to help you with would be really important. One of the last things I would recommend, that as a carer, you find a support person. So whether that is a counsellor, a psychologist, a paid person, or a friend, but someone for you. So someone you can check in and talk with about you. And it's all about yourself and how you're going, so you can keep continuing to do what you're doing as long as you want to. And someone who is going to go through the journey with you. A carer is often thought to be the forgotten patient, and it's essential that we remember who you are. Thank you.
Thank you so much, Sam and Daina. That was an excellent talk. We do have time for one question. There was just a question about whether you could give some advice on when is a good time to consider residential care.
Do you want to start?
I'll start. There is no specific timeline that I would say to consider residential care, it really is up to the individual, which I know can be quite an annoying answer because people really want some structure around this. Some people can continue caring for someone way before someone else may feel comfortable with it, depending on what's going on with their life. A lot of people start to consider, in my experience, a lot of people start to consider residential care around the time when issues of personal care become difficult to manage, in terms of the person receiving care may start to feel uncomfortable about their partner providing personal care, toileting, continence issues, those sort of things, or when the carer can't manage it anymore. And they might start with a little bit of respite and build up to find so that that person feels comfortable in that chosen residential care, and they may slowly move towards then. But it really does depend on what's going on in someone's life and what they're able to manage, and issues of aggression may come into play, particularly if there's younger children around. I think it's really what's going on for the individual.
I'll add to that. As part of my regular discussions, I try to introduce the thought of respite early on. So I agree with Daina about the personal care. That's when things start getting quite different, and that's often a trigger to residential care. But sometimes getting into the habit of thinking about the person going into respite, that helps the person with the dementia, and also as the carer to get used to that this person is going somewhere regularly in a place where they hopefully will get to be known by the staff, and we all feel comfortable that this person is having a bit of a break for themselves, and as a carer you're getting a bit of a break for yourself. And so if this, in an ideal world, starts happening on a regular basis, then it becomes less of a transition when you think about longer stints and then permanent care. So I think getting in early and trying to introduce this often really difficult topic, because I know there's a lot of rejection and, oh, you're abandoning me and you can't cope, that's hard. But thinking about coming to a decision together, I think is useful.
One piece of advice I might just add in is with respite, this is a very common problem and I see it all the time. An idea if you want to try respite is to book it well in advance.
Regularly.
If you want to try it regularly, you can do it regularly, but just to book it well in advance, depending on how comfortable you are with it, because you don't want to start having to access respite if there's an emergency. So if you break your leg or something happens to you, or you have your own healthcare emergency, that's when respite can be difficult to access, because it does require a bit of planning, and you may want to look around to find a facility that suits you. In an emergency, you aren't guaranteed that you'll find a facility that suits you, and you may end up having to go very far away from where you live, or having to pay more money than what you had hoped to. So that would be my thinking about respite would be plan ahead.
Yeah, I would agree with that, because then if you know that in 3 months' time or 4 months' time you're going to have a week or 2 weeks off, that helps you get through the period of time. And then everyone knows that it's coming, it's prepared, everyone's in control, and there's no sort of reactive or knee-jerk reaction if something's happening. It's, oh no, my loved one is going into care for 2 weeks for a bit of a break, I get a break, and hopefully that is a smoother transition.